Tyler Kowalski here with Kowalski Chiropractic, and today I'm just going to show you a few treatments that we can do if you have a really bad kind of low back flare-up. There's kind of different levels to low back pain. Sometimes it's been around for a long time, but every once in a while you get like a really bad flare-up where you have really bad back pain or some pain shooting down the leg. This case, I'll kind of walk you through how we would treat this case where it's kind of a lot of pain. You may be kind of walking out antalgic where you're kind of hunched over left or right, or those muscles are just really spasming and really painful. So in this case, say you came in with really bad low back pain and you can barely move, you have a really hard time getting on and off the table. We actually have this other table in a different room that kind of can raise and lower so you can get on and off if you're in a real bad shape. But in this case, we're going to kind of walk through what we're going to do for this patient. So say Zach comes in here and he has really bad low back pain, which he did a few weeks ago, and the muscles are really spasming, and say he might even have some pain going down the leg, and he has a really hard time moving. The first thing we want to do is just kind of help relieve that pain, calm those muscles down, calm all those nerves down. So one treatment we might start him on is this electrical stimulation treatment. So if you've been to PT or something like that, you might have had this done. This works really well with just kind of calming those muscle spasms down and just getting everything nice and relaxed. So what we would do here is put a few of these patches on the low back here, right where those kind of lumbar erectors run right through there. And then once we get these patches put on, we're going to slowly turn up the machine, and what you're going to be feeling as the patient is just kind of a gentle little tingly sensation. I'll kind of slowly turn it up until he would feel kind of a good strong tingle kind of going through those. We'd leave it on 5-10 minutes, kind of calm those muscles down, and just get everything nice and relaxed so we could work on him a little bit more. So that's kind of one treatment we'd start you with sometimes if you have a really bad low back flare up there. All right, another treatment we might perform if you have, like I said, a really bad low back flare up is this cold laser therapy. So this is a class 4 cold laser therapy machine, and what it does here is we run it over. When it's going, you might hear a little beep kind of in the background, and that means the machine's on. But what it's going to do here is if you have a lot of inflammation, a lot of swelling, it's going to help reduce the inflammation, and it works really good for a lot of disc patients. You have a bulging disc, and it's just going to help that heal up a little bit faster. So I use this machine a lot on different sports injuries, ankle sprains, pretty much a whole bunch of different soft tissue injuries to help decrease the inflammation and decrease the healing time, so help you heal faster. So that's the main thing we use it for. You can actually, I've used it on broken bones as well, just helping those bones heal faster, see really good results with that. But as far as the low back goes here, if he's in so much pain we can't really twist him or move him too much, it's a good therapy that we would just kind of run over the low back, help all those muscles kind of calm down, help with any inflammation, pain, and if there's a disc problem in that low back too, it's going to help that heal up faster. So what the patient's going to feel with this is just kind of a gentle warm heat. It feels really good actually when we have it kind of going over you just like that. So I just wanted to show you kind of what that looks like. Just another option, especially if you have a really bad flare up with the low back or have any kind of sciatica pain and you're wanting to get some fast relief. All right, another way we can adjust you, say we can't kind of put you on your side quite yet and you have too much pain and too much discomfort for that, there's some really gentle ways we can adjust the low back, especially when you have a real bad flare-up. So one way is with this adjusting tool. The way it works is I find the spots that are really locked up and restricted, and then we would adjust into those spots. And so you might hear that little clicking sound. That's the machine, or this adjusting tool, just kind of putting that gentle, good movement into the joint, loosening up, helping with the pain, and getting you healing up faster. So I'll show you just a couple spots. He has a few restrictions kind of in this lower back. And I can kind of add the pressure as needed, depending on how hard we want to adjust in. This can work really well too if you've had a previous back injury, you have a few spots that are fused up in that area. We can get really specific and adjust above and below the fusion. With this video, we're kind of talking more kind of low back pain when you have a really bad flare-up. So this is just a nice gentle way to get the joints adjusted, put that good movement in those joints, which will help you heal up faster. And as simple as that, you'll just feel a gentle little thump, get all the joints adjusted, moving well, get rid of all those restrictions, and kind of get you out of pain as fast as possible there. And another gentle way we can adjust the low back, especially if you have a disc injury, or like I said, it's really painful, we can't put you on your side or move you around too much, is with this Flexion distraction treatment, where my table's going to move up and down while I just gently adjust this low back, decompress it manually. So I'm finding each vertebra, just hold my hand there while I move the table up and down, and this is just gently decompressing that low back. Usually feels really good as we kind of can decompress and get those joints moving well. This is definitely one of the main treatments we use with a lot of our disc patients. If they have a disc bulge or disc herniations, you have pain going down your leg with sciatic symptoms, this is probably one of the places we'll start, just helping decompress the low back, helping that disc heal up and work its way back into the right spot. And I mean, with some severe cases, we'll refer you out. We'll always do a good exam before we treat you. In some severe cases, yeah, we will refer out. But usually, we like to start with chiropractic care, see if we can get you healing and feeling better, and avoid any injections, any surgery, anything like that. So this is just another gentle way we can adjust and treat the low back. Usually, if it's really flared up, we might just do this kind of treatment, the first treatment or so, till we can get things calmed down, lower that pain level, and then we can do some other stuff later on. So there's a Flexion distraction adjustment just like that.